Welcome back to our channel. So, have you ever left your doctor's appointment and thought, what just happened? What now? So in today's video, we will tell you 4 things you need to do after your doctor's appointment. Welcome to Prescribed, Healing Our Community. I'm Dr. Natasha, a clinical pharmacist.
And I'm Dr. Elena, a family medicine doctor. So, as Natasha said, we'll talk about 4 things you need to do after your doctor's appointment. First, schedule any follow-ups we've discussed during your appointment. This may include referrals to specialists, any tests or procedures that I've ordered, and lab work. I know it could be overwhelming when you feel like you have to see multiple providers, but this is for your own good. Oftentimes, if I refer you, it's simply because the concern is outside of my field of practice. Next, tests and procedures should be done prior to you coming back. Oftentimes, the sooner you get the test done, the sooner you get results, and we can figure out what's really going on. And we can determine, what ailments and what to do about it. And also labs. I know it may seem like you're getting labs every 2, 3, 6 months, but oftentimes it's just to make sure that your body is tolerating the medications appropriately.
Right, so there's a reason why we're getting it. So even though you just got it 2 weeks ago, if we're adding on a medication, sometimes it changes the chemistry of your body, right? We have to look at the electrolytes or other systems of the body to make sure it's not harming you and that it's still safe and effective.
Right.
So that's why we're always asking you, go to get your labs. So number 2, make a personal plan on how to achieve the healthcare goals discussed at your visit. So that could be a lot of things, right? So we're talking about log sheets, if that's recommended. I love log sheets. I love giving out log sheets to my patients. And yes, it absolutely will help me when you come back because I can just see a snapshot. She can see a snapshot of everything, your blood pressures, your blood sugars. But it's not only good for us, it's good for you because if you're writing down your blood sugar and it's constantly high, that's going to trigger you to say, what did I do today?
Right.
What did I eat today? So even putting little comments in there as far as why is your blood sugar high? Why is your blood pressure high? Oh, I just smoked a cigarette before I took it. Or, oh, I was incredibly stressed out today with my family. Those things help us because then we might not unnecessarily add on more medications
Right.
because there's something going on in the background as to why you have a high reading or a low reading too. Also, if the doctor wants you to lose weight, make small, attainable goals, right? So set some timelines, baby steps. So don't say, hey, I'm losing 50 pounds. That's a little bit too much for all of us, I think. So make smaller goals. What type of goals do you recommend with the weights?
Yeah, oftentimes I tell a patient our overall goal might be to lose 20 or 30 pounds within a certain time frame. But that's overwhelming for anybody.
Yeah.
Thinking of that big chunk of weight is very hard. So usually I say, let's focus on 1 to 2 pounds a week.
Yeah,
and I think that's a very doable and attainable goal.
Yes, exactly. So with that goal, you set the goal now. Now you need to make plans to make that happen. So that could be either getting a gym membership or just a dietitian so that you know what to eat and how to make that happen. And then also buy a pill box. Pill boxes are great. They keep you on track. They help you know and remember what you actually forgot. So if you're going back to your pill box for your evening meds and you still see morning in there,
Yep.
You messed up there. And then it helps you know, like, okay, I'm really forgetting my meds, what's going on in the morning that I can't get them, or vice versa. So pill boxes really help. And there are a lot of fancy ones out there, all patient dependent. So especially if you have a patient with dementia, let's say, there are some nice fancy pill boxes in there that will alert the patient and it won't go off until the patient actually gets the medication. So that helps you as well.
Yeah, those are really helpful tips for people.
Yes.
Number 3. So, in our appointment, we've discussed a lot of information. So be sure to call your provider if you have any questions or concerns. A lot of times you might need clarification. You've forgotten what you were supposed to do, or it wasn't clear. You've forgotten where or how to schedule certain procedures and what medications you're supposed to take. Always feel comfortable calling us. I'd rather you call rather than us finding in the next month or 3 months at your follow-up appointment that something wasn't done or something was done improperly.
Right.
Lastly, a lot of electronic medical records have accounts where you can email your doctor essentially or send a message to your doctor. And those are useful. If you've got a question or a follow-up to our appointment, feel free to use those. But sometimes if you've got new symptoms or new concerns, that's appropriate for another appointment, so feel free to schedule your follow-up. In this video, we discussed the 4 things you need to do after their doctor's appointment. So, your prescription for health. Call me with any changes or concerns.
And to fill that prescription, what she said, please communicate with us. We're here to help you all. So go to our website, and we put the link below to download our healthcare visit checklist that will help you navigate the visits with your provider. Also, remember to subscribe to our YouTube channel, follow us on Instagram at Prescribed, and leave us comments and let us know what videos you would like to see in the future. Thanks for watching. Bye.